Problems associated with reproduction. The next slides review a number of abnormal conditions associated with reproduction, the problems associated with reproduction, and prevention of abnormalities associated with the reproductive system. These include sterility, STIs, fistula, anemia, abnormal menses, cervical cancer, and maternal death. A fistula is the abnormal connection between two organs that are made of tubes. Usually, a fistula occurs when neighboring organs are damaged and then heal together incorrectly, creating damaged tubes. Fistulas occur in a female reproductive system when they have experienced trauma to their vaginas, urethras, and rectums. When these three tubes heal together, the woman cannot control her urination and defecation and has many unavoidable hygiene issues and infections. It can be corrected with surgery, but if it is not corrected, it typically destroys the quality of life and social status of the woman. Fistulas may also prevent women from having children in the future. This type of trauma may occur when girls go through childbirth before they're done growing and developing. Avoiding pregnancy until adulthood will prevent many cases of fistula. A cesarean section is required to deliver a baby surgically, but it is not available. In this case, the baby usually dies during childbirth. The mother may die during childbirth, and if the mother survives, she may have a fistula. Giving birth in a hospital where cesareans are available will prevent many cases of fistula. Medical checkups after childbirth will also protect the health of the mother. Sterility is the inability to have a baby. Sterility may affect males or females or both partners in a couple. If a heterosexual couple tries to have a baby for 1 year without using birth control and do not become pregnant, they are struggling with infertility or difficulty in becoming pregnant. In males, the most common cause of infertility is the poor production of sperm. The number of sperm per milliliter of emitted semen can be counted to check a male's sperm count. The sperm may also be of low quality. They can have poor motility or poor swimming ability, or may have chromosomal damage. Over the past decade, male sperm count has declined, on average, about 1% per year in developed nations where data are collected. Causes of decline in sperm production and sperm quality are unknown. However, some contributing factors may include poor diet, environmental chemicals including pesticides, advanced age, smoking, use of THC or marijuana, an immune response to sperm, some prescription drugs, trauma to the testicles, poor hormone production, STIs, tube blockages, diabetes, the inability to have an erection, and other possible contributing factors. In females, sterility or infertility may result from problems with any part of the reproductive system: the hormones, the ovaries, the fallopian tubes, the uterus, or the cervix. Hormonal imbalances that disrupt cycles of the ovaries and uterus, ovary problems that prevent the typical production of 1 egg per month, past infections in the fallopian tubes that left scars and blockages, advanced age and poor egg quality, fibroids or benign growths in the uterus, endometriosis or uterus cells growing in the abdomen outside the uterus, and poor cervix structure or function can all cause infertility. Couples struggling with sterility or infertility can try to learn what their issues are and develop a treatment plan with help from a medical provider. Research on infertility has shown that it often results from issues with both the male and the female, or it may be a male problem, may be a female problem, or the cause may remain a mystery. STIs may cause illness, poor sexual function, and decreased fertility. Taking precautions to avoid STIs can improve the sexual health and fertility of an adult. STIs are discussed in the immunity and infectious diseases presentations. Preventing STIs is also discussed earlier in this presentation. Anemia is a decrease in the number of red blood cells in circulation, leading to many problems including fatigue, anxiety, decreased sexual health, and headache. In order to make enough RBCs, you need to have enough iron in your diet. Iron is an important mineral for RBCs because each hemoglobin molecule contains 4 atoms of iron in its oxygen binding site, and red blood cells can't be produced or carry oxygen without iron. Iron deficiency is very common in children of sub-Saharan Africa, impacting all areas of child development. Anemia may lead to poor egg quality, poor sperm quality, and poor uterus function. Many short-term, limited studies also suggest that anemia caused by iron deficiency leads to a decline in sexual desire and performance. Getting enough iron in your diet by eating meat, like beef, pork, lamb, chicken, etc., eggs, organ meat, like liver, heart, or other organs, fish or shellfish, leafy green vegetables, peas, beans, and iron-fortified cereals prevents iron deficiency. Pregnant and nursing mothers must consume plenty of iron-rich foods to ensure the healthy development of their children. Abnormal menses, or irregular periods, may result from many causes, and in some cases the cause is not known. Women with irregular periods may have more difficulty becoming pregnant because they're not able to predict their ovulation or may have very infrequent ovulation. Hormonal cycles control the monthly cycles of females. Abnormal menses are the result of an abnormal uterine cycle and the unpredictable or infrequent shedding of the lining of the uterus. As we learned in this presentation, the uterine cycle is under the control of the ovarian cycle, which is under the control of the hypothalamus and anterior pituitary. So changes in hormonal cycles can lead to a disruption of normal periods. What are the causes of disruptions in hormonal cycles? There are many. Stress, poor nutrition, low body fat, poor thyroid function, or some types of birth control, like IUD, birth control shots, patches, or implants, may all cause changes in monthly cycles. Some medical conditions can cause very heavy bleeding or painful periods. Endometriosis, which is tissue normally growing within the uterus growing outside the uterus, and uterine fibroids, which are non-cancerous growths in the uterus, are two examples. Women struggling with these symptoms should see a medical provider. Cervical cancer is caused by some strains of HPV, human papillomavirus, which was discussed in the infectious diseases and cancer and viruses presentations. Cervical cancer is preventable with the HPV vaccine scheduled for 10-year-olds in Malawi.